True or false? Dabigatran is contraindicated in patients with mechanical heart valves. Which adverse reaction is most commonly associated with dabigatran? Is it A. bradycardia, B. hypotension, C. bleeding, or D. rash? Find out the answers at the end of this video. In this lesson, we will learn about Dabigatran for pharmacology nursing for NCLEX. Let's begin. Vital Nursing 101, your ultimate guide to nursing success. In this video, we'll be discussing an essential medication often encountered in nursing practice, which is dabigatran. This medication is commonly used but can have significant effects on the body, requiring careful nursing considerations. Let's dive into its indications, action, adverse reactions, contraindications, nursing responsibilities, and patient education. Starting with indications. Dabigatran, marketed as Pradaxa, is an anticoagulant medication primarily used for the following indications such as stroke prevention in non-valvular atrial fibrillation, treatment and prevention of deep vein thrombosis and pulmonary embolism, and post-operative thromboprophylaxis. Stroke prevention in non-valvular atrial fibrillation. Dabigatran reduces the risk of stroke and systemic embolism in patients with atrial fibrillation not caused by heart valve issues. Treatment and prevention of deep vein thrombosis, DVT, and pulmonary embolism, PE. Dabigatran is used to treat acute DVT or PE and prevent their recurrence. Post-operative thromboprophylaxis. It is sometimes prescribed to prevent blood clots after orthopedic surgeries like hip or knee replacements. All right, moving along, let's now learn about the action of dabigatran and how it works. Dabigatran belongs to a class of drugs called direct thrombin inhibitors. Here's how it works. Dabigatran directly inhibits thrombin, an enzyme essential for converting fibrinogen to fibrin, which forms blood clots. By blocking thrombin, it prevents clot formation and reduces the risk of thromboembolic events. Unlike traditional anticoagulants like warfarin, dabigatran does not require frequent INR monitoring, making it more convenient for patients. Adverse reactions. While dabigatran is effective, it's not without potential adverse effects. Common adverse reactions include bleeding, gastrointestinal symptoms, allergic reactions, and hematologic effects. Let's learn about each common adverse reaction now. Bleeding. The most significant risk ranging from minor bruising to severe hemorrhages. Gastrointestinal symptoms. Patients may experience dyspepsia, nausea, or abdominal pain. Allergic reactions. Though this happens rarely, hypersensitivity reactions like rash, itching, or anaphylaxis can occur. Hematologic effects. Some patients may develop anemia due to chronic blood loss. Encourage patients to report any signs of bleeding, such as blood in stools, urine, or prolonged nosebleeds, as well as any unusual bruising. Contraindications. Dabigatran is contraindicated in the following scenarios. Active bleeding. Patients with ongoing bleeding or bleeding disorders should not use dabigatran. Severe renal impairment. Dabigatran is eliminated through the kidneys, so patients with a creatinine clearance of less than 30 milliliters per minute are generally not candidates. Prosthetic heart valves. Dabigatran is not approved for patients with mechanical heart valves. Hypersensitivity. Patients with a known allergy to dabigatran or its components should avoid it. Nursing considerations. Remember that as nurses, we play a critical role in ensuring the safe administration of dabigatran. Here are some nursing considerations. Baseline assessments. Obtain a detailed history of bleeding disorders, renal function, and concurrent medications. Monitor for bleeding. Regularly assess for any signs of bleeding or bruising and educate patients on what to look for. Lab monitoring. Although dabigatran does not require INR monitoring, check renal function periodically. Handling missed doses. Advise patients to take the missed dose as soon as possible unless it's close to the next scheduled dose. Never double dose. Transitioning from other anticoagulants. Follow specific protocols when switching from warfarin or low molecular weight heparin to dabigatran. Patient education. Patient education is critical to ensure safe and effective use of dabigatran. Highlight these key points. Medication adherence. Stress the importance of taking the medication at the same time each day to maintain consistent blood levels. Signs of bleeding. Teach patients to recognize symptoms like black stools, pink or red urine, and prolonged bleeding. Avoiding injury. Advise on precautions to minimize the risk of bleeding, such as using a soft toothbrush and avoiding high-risk activities. Drug interactions. Inform patients to avoid non-steroidal anti-inflammatory drugs and herbal supplements like ginkgo biloba without consulting their healthcare provider. Storage. Keep Dabigatran in its original packaging to protect it from moisture and ensure efficacy. Travel and surgeries. Encourage patients to inform all healthcare providers about their use of Dabigatran, especially before surgeries or dental procedures. Dabigatran is a valuable anticoagulant for preventing and treating thromboembolic events. However, it comes with risks like bleeding and requires careful patient management. As nurses, your role in monitoring, educating, and supporting patients on Dabigatran is vital to their safety and well-being. Okay, now here are the answers to the questions from the beginning of the video. True or false? Dabigatran is contraindicated in patients with mechanical heart valves. The answer for this is true. Why? Because Dabigatran is a direct oral anticoagulant that inhibits thrombin. It is contraindicated in patients with mechanical heart valves because clinical trials, such as the REALIGN trial, have shown that it increases the risk of thromboembolic events, for example strokes, and bleeding complications in these patients compared to traditional anticoagulation with warfarin. Keep in mind that mechanical valves create high shear forces, which may lead to platelet activation and clot formation. Dabigatran does not provide sufficient anticoagulation in this setting. Okay, last question. Which adverse reaction is most commonly associated with Dabigatran? Is it A. bradycardia, B. hypotension, C. bleeding, or D. rash? The answer here is C. bleeding. Alright, well, that ends this nursing review. If you found this video useful, leave a like and a comment so we can continue to make more videos like this. See you again.